Welcome back to the second part of the lecture. This is for chapter 33, part 1. And we ended off, we were talking about unloading guidelines, and the last sentence I said is, if sterilization is in question, always autoclave again. Very important. Let's talk about the shelf life of sterilized packs. So the CDC no longer identifies the specific time limits that the shelf life has to be for sterilized packs. But usually in an office, you follow the office protocol guidelines. I know for pediatrics, when we sterilized, we would write an expiration date of 6 months out. So if we sterilized it today on January 30th, 2020, we'd go February, March, April, May, June, July, right? Because that's 6 months. And we would write EXP and then 7/30/2020 on the pack, as well as identifying what's in the package, making sure the date that we autoclaved it and our initials so we know who autoclaved it. So general recommendations, as long as the sterilized items are stored so that the packaging material remains intact and undamaged, then the pack is considered sterile. All sterile packs should be stored on dry, dust-free, covered shelves or in drawers. So typically you want to use drawers or cabinets, and then we also had we had like the little plastic tubs, so that added more protection, and they were organized by how they were sterilized. So again, this will depend on your office and what your protocol is. So chemical sterilization, materials to be sterilized must be submerged in the chemical bath with a closed lid for 8 hours or longer. So that's really important. So this is used for instruments that cannot be exposed to high temperature or steam. Sterilizing solution must be mixed exactly according to the directions, or it doesn't work. The use of chemicals for sterilization is not very practical in the ambulatory facility because the instruments or equipment cannot be wrapped during the processing. And high-level chemical disinfectants do have a place in healthcare because they can be used on the instruments. Again, we need to know what the safety risks are. We need to handle the chemicals correctly. We need to keep logs. And like I said at the beginning of this slide, if they're in a chemical bath, it needs to be 8 hours or longer. Let's look at surgical procedures. So suturing, cyst removal, incisions and drainage, I&D, that is a med term abbreviation, or abscesses, and collection of biopsy specimens are all surgical procedures that you might see in a minor surgery office. So be proficient in explaining each of these procedures to the patient if your doctor does these, and you're usually going to be going through it with them so that you can get them to sign the consent. So it's important that you're very proficient and that you explain in detail. Preparing the patient and the room, assisting the physician with surgery, and applying a sterile dressing and bandage after procedure is finished are all parts of your job as a medical assistant in a surgical procedure. Electrosurgery, so using high frequency current to cut through the tissue, okay, and coagulate the blood vessels. Remember I told you cauterizing, we talked about the smells that you have to be okay with, and with cauterizing it is burning flesh. Small probe with electric current running through it. So that electric current is also important that you are careful with if you're holding it and then passing over to the doctor and he's passing back, just like I showed you instruments and sharp instruments last week. It's really important that you hold it correctly and that you're very careful because there is an electrical current running through it. This is used to conceal blood vessels. It minimizes cellular oozing and bleeding, and it's also used to destroy granulations and small polyps. So holding the pencil-like instrument, the surgeon touches the tissue with a tip and it activates the electric current with a switch on the instrument or a foot pedal. So again, if that switch is on and you're passing back and forth, if he asks you to hold for a second, while he gets a better view or is using retractor to get in better, it's still important that you handle it as if it's always active, because if that switch is on or his foot happens to still be on that foot pedal, there is an electrical current running through it. Laser surgery, the laser light destroys tissue. It can harm the patient, the physician, and you if it's handled improperly. So it's really important that if you do work with laser surgery, sorry, when I talk, I just stumble over my words. If you're working in laser surgery, it's really important that you understand the proper use. You must be specifically trained to operate a laser before assisting with laser surgery. This is not something that we are going to really go over very much in our class. If you do end up working in a laser surgery situation, the doctor will be giving you additional training. Your role in laser surgery is to observe the surgical field with your safety goggles, right? We're protecting our eyes from that laser. You keep wet sponges ready. You remove flammable items from the laser path, assist with suctioning of the plume to maintain a clear, visible field. You have a basin of sterile saline and field irrigation syringe ready for the physician. And as always, you anticipate the needs for prospective supplies, equipment, and instruments for the physician. Microsurgery. So this involves the use of an operating microscope to perform delicate surgical procedures. Must acquire a basic knowledge of the operation and care of a microscope, and it is expensive and delicate. It must be handled with extreme care. Again, this is something that's very rare in the ambulatory care setting. If you happen to end up working in the field and the doctor feels that he would like to give you additional training and have you work in this area, then you would need additional training before you were working with him in microsurgery. So we talk about it, but it's not something that we go over in labs. Endoscopic. So endoscopic procedure, the device consisting of a miniature camera mounted on a flexible tube with an optical system and a light source that is used to examine the area inside the organ or cavity. Small instruments can be used to take samples. So again, we talked a little bit when we talked about assisting in gynecology when they take the samples. So your major role in this would be to make sure that the equipment is running correctly, that everything that the doctor needs is ready to go, and then that you also have, however, if he's taking a sample or something, you have everything labeled for the sample so that as he takes it, he can place it. So it's really organizing and making sure that everything's prepared for the doctor. Cryosurgery, this is very low temperature probe that destroys tissue by freezing it in contact. So what do you think the temperature of the probe is? The probe's temperature is usually below negative 20 degrees Celsius or 4 degrees Fahrenheit. Cryosurgery is often performed in an office setting or in outpatient surgery center. So cryosurgery is less invasive than traditional surgery. And again, with this, you would want to make sure that everything is set up for your doctor correctly, that everything is in working condition. If he's going to be taking any samples, that everything's labeled correctly, and then handing off whatever he needs and anticipating his or her needs as they go. It's important that we know how to prepare a patient for surgery, because this is another huge role in minor surgery for medical assistants. So patients need both psychological and physical support. You want to make sure that the patient understands the details of the procedure and is able to voice any concerns and ask any questions that they need to ask. And we need to do all of this prior to getting a consent. We always have to get a consent prior to any surgeries, and typically this is your responsibility to make sure that that consent form is signed and on hand for the doctor prior to a surgery. Also, we want to ensure any blood or urine tests consent forms are completed, that they know where they're going to go if they need to have the blood and urine test done prior to surgery, explaining to them why they need this, finding the lab for them, and then making sure that those are completed prior. You also might be doing shave prep, cleansing enemas, food intake restrictions, and special bathing or administration of a sedative. And vital signs are recorded and the patient empties the bladder and puts on a gown. So typically prior to the surgery, you want to gather the most current vital signs so that you can monitor them through the surgery. If you cannot answer a question, assure the patient that you will relay the message to the physician before the procedure, and then be sure to do so. Don't just tell them you'll do that and then forget. Make sure that you relay that message, get your answer, and go back and make that patient feel comfortable and make sure that they understand whatever the question was, their answer to it. Preoperative instructions are important. You need to have the necessary consent forms ready to sign, give the patient the necessary preoperative instructions such as medications to be used, special skin cleansing, etc. You need to tell the patient to bring a relative or friend to drive him or her home after surgery, instruct the patient to leave jewelry and other valuables home, and call the patient the day before the scheduled surgery to confirm that they understand and remember those special instructions. Another really important thing about preoperative instructions is that sometimes they are instructed to not take certain medications, even over-the-counter medications, for like 10 days prior. For example, ibuprofen. They need to hold off on ibuprofen. It can be a blood thinner. Aspirin can be a blood thinner. So it's very important if there's any preoperative instructions on medication that not only you go over it, but that they understand how important that is. A lot of people are on blood thinners and they need to speak with their physician about what they're going to do in place of the blood thinner for a certain amount of time. And again, that needs to be explained to the patient. Informed consent. You must have the patient's written informed consent before beginning any surgery. Again, they must understand the procedure. They want to know the potential risks and benefits of the surgery, and you need to go over that with them and make sure that they understand that and that they know that there are alternatives such as and including no treatment at all, and then the risks of any of these alternatives that you give them. After this discussion, the patient either consents or refuses the surgery, and they need to sign that consent form or the refusal form so that you can document that. If a patient signs with an X, the medical assistant should write patient's mark beside the X and should also have a family member witness the signature. Again, protocol, this is just one way or thing that might happen, and you would need to make sure that you know the protocol in your office as far as that goes. The discussion must be fully documented in patient medical records. So once you do the informed consent, you need to document that you did it. And a copy of the signed form must also be included in the patient's record for documentation. The patient must not be under the influence of any sedative medication at the time that he or she signs that consent form. Very important. Patient positioning, which we spent a lot of time last semester, and I told you last week, you got to know these and make sure that you are familiar with them, because for surgical, patient positioning is key. If the patient has an open wound that will need irrigation during the procedure, wear non-sterile gloves to assist the patient into a position that is needed. If there is active and profuse bleeding, an impermeable gown and gloves should be worn, and we'll talk about the gown, mask, glove. If the danger of blood and bodily fluid contamination to your face or eyes, you need to wear a goggle, a mask, and a face shield. Again, remember our PPE. It's so important. Skin preparation. And we're going to go over this, but the goal of adequate skin preparation for surgical procedure is to reduce the number of transient and resident microorganisms so that the transference of harmful organisms at the incision site is limited. You need to cleanse the site with surgical soap and antiseptic and shave the area if needed. Disposable skin prep trays and razors are commonly used in this procedure. Sometimes the patient may be instructed to repeatedly cleanse the surgical area